Why are cultural issues important in psychotherapy overall? Cultural competencies can allow providers and patients to create a trusting relationship. According to Shahafi, 2019, cultural competencies help to allow knowledge and skills to increase the patient's encounters with nurses. This allows healthcare providers to better serve different populations. This can allow providers to gain trust and have better overall treatment plan compliance. This is why different cultural identities and beliefs impact how patients see their providers. Cultural issues surround proceeding of trauma for this population. The issue of trauma is a major health problem in Latin American populations. This particular population has a high level of religious influence that does not always relate well to Western medicine. This group seeks counsels from friends and families before seeking medical care from providers. This can limit the amount of compliance providers can have with this population base. According to Dasari, 2021, patients who have had stress or trauma tend to prefer psychotherapy over any medications in Latin American populations. This is great information to know when treating patients from Latin America, that they want to talk to someone before prescribing any type of medication. The Latin American population tends to have a large Catholic religious following. This population base fosters the idea of independence within the culture, which can make engagement difficult. According to Kress 2022, Christian views tend to facilitate traumatic outcomes in patients from Latin American countries. This means that this population base will talk with a spiritual advisor before reaching out for outpatient support. There is also a language barrier that can create difficulty in using psychotherapy as a means of trauma treatment for this population. Finally, this population of Latin Americans does not always have access to insurance or the financial resources to receive the care that is needed for trauma and stress-related illnesses. The Latin American population has a large, diverse base. According to De Mello, 2021, the social structure is based on a class system of rich and poor and lacks middle class in most areas. Culturally and spiritually, this population base is mostly a Roman Catholic base that is very devout. Not all of the population speaks Spanish, with parts of Latin American culture also speaking the Portuguese language. Economics of this population tends to be a risk-averse population that tends to pay in cash at the time of the transaction and values savings. While there are a lot of traditions that are integrated into the Latin American culture, most of them have religious views and have significance to the independence of each Latin American country. This unique population base has a high value on religion and keeping their cultural values passed on from generation to generation. Additional information. This population is often confused with the Hispanic population, but is similar but different. The Hispanic population often refers to only individuals who speak Spanish or are from Spanish-speaking countries. The Latin American population is a better all-encompassing term that describes all persons from that generalized area. In the medical community, it is better to use the term Latin American to better describe individuals from this part of the world.